Hi everyone, we're back, and I want to talk with you about all the positive things that we can do to help babies be healthy and give them the beginnings that they'll need for their strong development throughout their lifetime. So, we want to talk about how we can diminish the impact of teratogens and increase the likelihood of healthy development. The best thing we can do with that in that area is maternal nutrition, making sure that the pregnant mother has access to healthy and abundant food so that the mother is not hungry and that the mother is able to access healthy food choices. So this becomes really important when we talk about women who live in poverty or women who live in areas where they may not have access to healthy foods. So making that available to them is extremely important. And for women who have access to abundant food and enough food, then also making sure that they make those healthy choices and are aware of the choices that they need to make to have a healthy diet. The other important part of this is maternal stress. So women who live in situations where they have healthy alternatives to stressful situations, where they can take themselves out of stressful situations, or where they can use de-stressing strategies like things like exercise, eating well, getting plenty of rest, being able to do and engage in prenatal activities like prenatal yoga classes or prenatal meditation classes where women can are able to center themselves and really focus on self-care. Those things are extremely important, but not always available to everyone. So remember that some of the children that you might be working with are from homes where the mom may have to work one or two or sometimes three jobs to take care of the family even while they're pregnant. So that creates a lot of stress and a lot of anxiety. Never mind all the other issues that can go along with someone's home life. So those are important things to keep in mind when we think about the situations our children are born in. The other way we can really take care of, mothers can really take care of themselves is by being part of a social network. And by a social network, we mean things like having strong family supports, having strong friend supports, and also having access to healthcare and resources that nurture and support the pregnant woman. So having access to prenatal classes and prenatal programs where they can get support for during the time that they're pregnant. And that follows really into prenatal care. So comprehensive care has to begin at the latest in the first trimester. We would like it if the mother is caring for herself going into her pregnancy and talking with her doctor about the choice of becoming pregnant so that she is preparing her body for the healthiest possible pregnancy. So early care, early knowledge about problems that can occur so that the mother can make the best choices for herself and for her child. And also making sure that the medical professionals she's working with are aware of any complications that may occur so that then what happens is that sometimes even with the best care there are problems in a birth or problems in the child's development, and those professionals can be in the delivery room and waiting to support the newborn child. Now, one of the other pieces of this is encouraging the relationship between the mother and actually the entire family with the developing fetus, so that we really believe from the research that the child's prenatal language experience affects their post-birth development, so that the sounds and the stimuli that occur while the child is in utero can have a really positive effect on the child's development as after they are born. So that we know that children that hear music, that are talked to, that are read to, have stronger language development than children who do not receive that kind of nurturing when they are in utero. The mother and the fetus, or the mother and the unborn child, really are in a real relationship, a symbiotic relationship where their cycles match, their sleep and wake cycles match. Especially in the last 2 months of development, we find that the woman, the mother and the child often sleep at the same times. They are awake at the same times. The baby is active when the mother is active. And that kind of relationship is really great for the baby's strong development. Likewise, if the mother is feeling stressed, if the mother is dealing with trauma, the unborn child is going to be experiencing that as well. Pregnancy is different across cultures, and it's influenced by the traditions that people come from, but also the healthcare system and the prenatal care that a mother receives. So different cultures have different approaches. One is not necessarily better than the other. It's just what's culturally appropriate. So that you may have a culture where the woman is not, where the woman does not work at the very end of her pregnancy, that where she is not recommended for exercise, to do strenuous exercise. And then you have cultures where we're running or working right up until when we have our babies. It just really depends on the culture and the healthcare system that the mother is from. Sometimes women that come from different cultures to the United States conflict with the United States, the U.S. healthcare system. That doesn't always mean that the U.S. healthcare system is right, but it's just oftentimes a cultural conflict. And you'll see that sometimes you'll work with children whose mothers will approach their pregnancy and their child rearing in a really different way than you were brought up, than you were nurtured as a very small child, and how you were nurtured in utero, or how you might nurture your own children. And you have to accept those differences. As long as the child is safe, then there are no problems. Healthcare policy on a national level really impacts prenatal well-being. We know that children that get very good care from 0 to 5, and by 0 we mean that prenatal care as well, women who have access to healthcare, women who have access to prenatal care as well as postnatal care, have the child has stronger development, and that stronger development from 0 or -2 to 5 means that the child is set up for a much stronger experience, a cognitive and physical and social. Their cognitive, physical, and social emotional development is going to be much stronger. We want that kind of care, and we want that kind of support for our children. It saves us money. As we know, we read this previously when we talked about how we can ameliorate childhood trauma. The more money we spend on the front end with children saves us money on the back end with adults who are able to contribute successfully to society. There are lots of different birth options, and sorry about that. There are lots of different birth options, and one of those is the traditional having a child in a hospital room with the current technology and all the medical care that they need. But there's also all types of different types of childbirth now. There are water births, there are births with many births with midwives. There are home births. And, remember, children are being born all around the world in all different ways. Right now, as we're talking, they're being born in small villages, in Asia and Africa, and in homes around the United States, and then they're being born in luxury birthing suites at Brigham and Women's Hospital. So there's all kinds of birthing that goes on, and all of them have their pros and their cons. What is important for you, I think, as a teacher to remember is to think about talking with your parents when you have concerns about the children in your class, especially those of you who work with very young children, even children up until ages 5 or 6, because you may start identifying learning challenges that they have, or learning disabilities that they have. And when you start to do that, you want to go back. When you're looking at learning disabilities, we want to go back to the birth experience of the child. So there are all kinds of delivery complications that can occur. Sometimes those delivery complications require that we have a cesarean section. Sometimes that the most common reasons for having a cesarean section are things like where the fetus is, like in terms of development. If they are 2 weeks past overdue or a very large child, sometimes we'll have a C-section, fetus lying in breech, the problems during the delivery where the delivery is going forward too slowly. That happens sometimes, and for the most part, those births are without a problem, and the child develops fine. One of the probably the most common occurrence, the most common problem during delivery is anoxia, and this usually occurs because the umbilical cord blocks or tangles around the child during childbirth. And we know that it is not uncommon for children who experience that to have learning disabilities. Not insurmountable learning disabilities, but certainly challenges or differences in their learning processing. When that occurs, it's important for us to know about that as teachers in early childhood. Now, we want to talk just for a little bit about multiples. Some of you might even be a multiple. Some of you might be a twin or have a twin in your family. And actually, I'm sharing with you on this page some pictures of the twins and triplets that are in my family. This is becoming more and more common, and you'll find as you go through your education careers that you will see more and more children who are multiples or who have multiples in their families. This is really common because of in vitro fertilization, when we take multiple eggs from a mother and fertilize them in the lab with the father's sperm. When that happens, we have a greater number of fetuses in one pregnancy. Sometimes we have identical twins, and sometimes we, but more commonly went through in vitro, we have we have multiples, and which is why we see many more because of the technology. These children are able to survive, and we see many more multiples. For example, triplets and even quads, but triplets and twins are usually the most common. They tend to have low birth weight, though not always, but the birth weight does tend to be lower. And we do see problems that occur. Respiratory problems are the most common, though we do see learning difficulties as well, just because when children have to be, they're often delivered early, and when that delivery happens, they aren't always fully developed. Many times they'll end up in the neonatal intensive care unit or the NICU. Sometimes you'll hear about that. And but as you can see from the twins we have and the triplets we have in our family, things seem to work out pretty well. Certainly there are challenges for these children with autism spectrum disorder and learning challenges, but but healthy atmospheres and healthy education bring them forward